This is Live Well Talk on a day in the life of a medical surgical nurse. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Today's episode is part of a series on the podcast where we sit down with team members in various roles at Unity Point Health Cedar Rapids and get to know them, find out what they do on a daily basis, and maybe perhaps find out why they joined the team and why they remain. Joining me today on this episode is Ellie Ledger, a registered nurse on the medical surgical floor with St. Luke's Hospital, to discuss the role of med-surg nursing and what she does on a daily basis. Ellie, welcome to the podcast.
Thanks for having me.
Where are you from?
I'm from Washington, Iowa.
Washington, Iowa. Because I think I asked you that once about whether or not you played sports, right?
Yeah. Yep.
Which everyone in Washington, Iowa probably played sports.
Yep.
Just kind of go through where you trained. I mean, I'm sure you have a BSN.
Yep.
And how you got that and how you kind of got interested in nursing.
Yep. So I don't quite have my BSN yet, but I went to Kirkwood for my ADN. And I was up here for clinicals. I did a lot of different hospitals for clinicals, and I was actually here on 5 Center once, and I really enjoyed it. So after college, we kind of had someone approach us about the surgical specialty unit here. So it was really intriguing with all the different surgeries coming through and it being a brand new, nice unit. So I started on the surgical specialty unit. I've been here for 2.5 years.
Wow. Well, we're glad you're here. So you work on your BSN?
Yeah.
And through what?
I think I'm going to do it through, I haven't fully decided, but Washington online.
Yeah.
Because it's like a 2 or 3 year online program, and I've already done a lot of the prerequisites that they require. So.
Yeah. Grandview's another one online. I think a lot of people do that too. Take us. What we talked about the BSN, but what does it take to be a nurse from a licensing standpoint?
So, for me as a med-surg nurse, you just get your associate's degree of nursing from a community college or a university, and then you take your NCLEX or your state boards test, and then once you pass that, then you're
Iowa. And is there, like physicians, is there a requirement to keep up on certain continuing medical education?
So we have our CEUs. You need 36 every 3 years to continue keep up on your license, and then you renew every 3 years with the Board of Nursing.
Can you do some of that stuff online? I mean, that's what we do for physicians.
Yep. A lot of it is online. You get continuing education credits too for like precepting students here, which we do all the time on the floors. So there's a lot of different ways to get your points. Okay.
Yeah, as before the age of the internet, you had to go off to some conference, but now you can pick it up through, and it's really practical, I think.
They do offer a lot of conferences. I've even heard people go on cruises to get their education units. Which is kind of cool.
I'm distracted too easily. I wouldn't do very well. So walk me through a typical day.
Well, it kind of depends. I'm a day-night rotator, so it looks a little bit different every day. But when I first get there at 7...
Day-night rotation will get a lot harder as you get older. Just the morning right now.
Yep. So when I get there at 7, I just get report on all of my patients, introduce myself to them. And then I like to go back out and kind of look through their charts and get an idea of what the plan is for the day, know any labs or orders or anything like that. And then I go back in for our morning assessments and med passes. Throughout the morning, we like to do a lot of discharge planning because at 11 o'clock, if the patient is appropriate for discharge, we like to get them home to their family by 11. It's kind of our goal. So we, throughout the day, are really focusing on ambulation on the surgical unit. We like to get our patients moving 4 times a day and rounding hourly. We do a lot of reassessments every 4 hours on our patients. So vitals every 4. Our main reassessment, though, is at 3 o'clock. And then throughout the day, we're kind of answering call lights and, caring to the patient's needs.
I think it's important just to outline because I know you know this, but in other healthcare professionals that work at the hospital understand this, but for the patients and families, the reason we try to get the patient out earlier in the day is to open up that bed for someone from the ER so they don't have to wait in the ER or one of the ORs. They don't have to wait in the PACU to get, so we're not doing it because we don't like the patient. Right. We're doing it so we can keep patients moving because nobody wants their loved one to have to wait someplace.
They don't want to hang out here any longer than.
Absolutely not. I would like to brag a little bit about the Iowa Great Nurses They select 100 nurses, and 10 of them were here at St. Luke's. So you want to say 10% of the great nurses were here at St. Luke's, and I think that's an impressive statistic.
I didn't know that. That's really cool.
I find it fascinating. Each floor has their own personality. It's different. I mean, they each have their own personality, and I find that really neat. But one thing that I would like you kind of talk about is, as a nurse, it's kind of you, the patient, and the clock. And you're trying to manage your time throughout the day. I once read that the average floor nurse makes like 50 some decisions every hour. So kind of take us through the decisions you make during the day.
Yeah. So a lot of times, we're reassessing our patients. If there's any changes that we know or anything we are concerned about, we need to get in touch with providers right away. And there are a lot of orders that we can put into our emergency guidelines and stuff like that. So deciding if now is the right time to utilize one of those emergency guidelines or protocols that we have in place, and kind of fielding questions from the patients and the family members as well, and helping. We don't, make any decisions for them, but helping them kind of guide them through what the plan is and how they can help their loved one as best as they can as well. So there's a lot of different things that kind of go on throughout the day.
I don't know about you. The people are the best part of the job, right?
Yeah.
The patients. I mean, they each have their own story, and it's just, it's neat. What drew you? You said you rotated here, and you like the culture here, and one another thing to highlight is we've been a magnet hospital 5 times in a row, which is significant for nursing. That's an accolade that a lot of places don't have, as well as the top hospital in Iowa, recently selected by Newsweek magazine. So those are things to brag about. But what got you into nursing? Why did you want to become a nurse?
I wanted to become a nurse. My older sister's a nurse, so that kind of led me there too. She's now a school nurse, but she used to work at the Washington County Hospital.
Okay.
And then she's a school nurse for the Wayland Community School District. Okay. So, yep.
Neat.
Yeah. It's pretty cool. So there's a lot of different opportunities that nursing brings. You can do so many different things with it, which I found really intriguing. Yeah. So the hours are flexible wherever you go. So.
You could, I know, people I went to high school with that went on to be nurses that work for insurance companies, that do pre-authorization, that do education, school nursing. We have nurses that do IT, now. And so it really has, there's a lot of opportunities with nursing. Ellie, thank you for joining me and sharing about your day in the life of a med-surg nurse. I'm honored to work with my nursing colleagues. I really enjoy being around them, and they do a fantastic job. Once again, this is Ellie Ledger, a med-surg nurse with St. Luke's Hospital. If you're interested in a career as a nurse or any other role at St. Luke's Hospital, visit joinuph.com. That's join, JOIN, uph.com. Thank you for listening to Live Well Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.